faithtodaytv.co.ke.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.
Only 3 in 5 children with pneumonia symptoms in sub-Saharan Africa get to see a healthcare provider. That is according to the State of the World's Children's Health by UNICEF. Now, studies reveal that pneumonia kills more children under 5 more than any other infectious disease worldwide. Is it just a cough, a common cold, or even pneumonia? Parents, guardians, and caregivers, this is a discussion you don't want to miss. Join us. Greetings and welcome to yet another episode of The Healthy You. This is your favorite health program on Faith Today Television. We bring you weekly expert insights about health. My name is Enock Kitondekijja, your host. Now, a special thanks goes to JCK Hospital. They make this program possible. They are in Roysambu. You can find them in Mariaini. They are also in Juja. Now, needless to say, these people are really making great strides in the healthy sector. They have improved thousands of people's lives. They are also now building careers. As you've seen, the JCK Hospital College of Health Sciences is now taking in their second intake. So if you're interested in pursuing your course in healthcare assistance, this is the time. Use that number on your screen, reach them, and they'll be right there at your service. For any emergencies, still, there's JCK number on your screen. Now, today is a special day, and we are talking about pneumonia in children, and the season calls for an urgent attention. We have a doctor from JCK Hospital, who's going to help us break this down. And now this is no ordinary lady. She has a great experience in handling diseases. She's also a believer. You don't want to miss hearing from her. But before I invite her to take us to the next level and unpack all that she has concerning pneumonia in children, I'm aware we have most of you who follow us on social media. We appreciate you and we want to remind you to subscribe. If this discussion makes sense, please go ahead and share it with as many people as you can. Thank you so much. Back to my guest, Dr. Joy is in the building. Welcome to Faith Day Television.
Thank you, Enock.
I mean,
To be here.
you're glad. I like the quote. I remember about 7 years ago when I was just dressed like you. I don't know how does that feel?
It feels great.
It feels great.
Yes.
I mean, just introduce yourself to our viewers. I know they have been waiting to hear. Who is this Dr. Joy? Kindly.
Thank you. Thank you for having me today. My name is Dr. Joy Kuria. I work with MBChB Hospital as of now. I am very happy, very, very happy to be here. I'm also a born-again Christian. I love the Lord Jesus as my personal savior. I believe that even as I help people in the health industry, it is God himself who heals. And I am only here to be used as his vessel. So I am very happy to be a doctor and to be also serving God in my fields. Yes.
Wow, that's a great welcome. And I must submit to you that this program is entirely helping people to understand that yes, you guys have your part, but also God has a better part he plays concerning our health. Now, for our viewers, having such an intro from Dr. Joy, I should tell you that today we're having value, someone who has studied your body, your health, but also believes in the Creator as the ultimate God who can help you go through whatever you're going through. So, as always, I want to remind you to don't watch alone. Make sure that you share this with as many people as you can as we unwrap it. Back to medicine. Let's talk about pneumonia. Recently, I heard so many cases that are coming up, more so in children.
Yes.
For a start, with clarity, help us understand pneumonia in children and how does it affect their the children, the lungs. Why is it coming up in this season?
Okay. So pneumonia, first of all, I'll start by describing what pneumonia is. Pneumonia is an infection of the lung tissue. So it comes from bacteria, it can be from viruses, from protozoans. I don't know if I'm using a lot of medical jargons. I hope you'll be able to understand.
Yeah, infections.
Yes, infections basically. And also there's another type of pneumonia called aspiration pneumonia. This happens especially in patients who have cerebral palsy or in patients with seizural diseases, where they tend to inhale products from the mouth. So especially if they are kept in a position where they are not able to swallow, they tend to inhale it. It goes to the lungs, and then now the food becomes a proper place where the bacteria can grow, and this may cause pneumonia. So we have said it's an infectious disease, and also you can get it from aspiration pneumonia. Yes, and also when you have an infection, for example, when you have a UTI in the blood system, when the bacteria gets into the blood system, it tends to spread. It can also affect the lungs. We call that hematogenous spread. That means the bacteria has spread through the blood into the lungs. Those are some of the ways how you can acquire pneumonia. And the way you acquire the bacteria is from inhalation. So maybe someone else has a cold and then they cough. When you inhale that, the bacteria tends to enter your system, right? And that may lead to pneumonia. That's one. Yeah. And then the other one I've said, hematogenous spread, where it spreads, infection spreads from different areas where you have an infection into the lungs. Yeah. And then now the aspiration.
Well,
Yeah.
and I think that's a good preamble to start
Okay.
of our discussion. Our focus today, I want you to help us understand how the children are affected by pneumonia? Because the report I got was that there are so many cases in children. Is it because of the seasons that have changed? Is it the cold weather? I mean, how are children really affected by this pneumonia, and what really happens?
So our body is created in a way. God was very, very, very intentional about every part of our body that was created. So our body is created in such a way it is able to fight infections, okay? But now, during the cold season, most times your immunity tends to decrease a bit. So we know that the nose plays a very vital role in protecting your body from infections. Inhalation, those things we've said you can inhale the infection. Our nose plays a part because of the mucus it has. Now during the cold, the mucus dries up. Now you see you've decreased the protective barrier of the body. Even the mucus inside your trachea and all those things that help protect your body from the infection, they are decreased. So now during the cold season, we tend to see that the person, and particularly children, they are highly predisposed to the bacteria because their natural defenses in the body have decreased. That's why we see a lot of pneumonia in children. Yeah, especially now in the cold season.
Okay, and that's helping us understand now how it comes about, and what are some of the early signs and symptoms that parents should never take for granted, because a baby could, or maybe your child could have maybe a cough and they really don't take it serious. Some parents think that it's only the malnourished children that can get pneumonia. Help us understand those, early symptoms, early signs that parents should never miss out on.
Okay. So the signs and symptoms of pneumonia, as you've said, cough is one of them. The cough will be productive. That means there will be a sputum production. Sputum is the common thing we call kikohozi. That's what sputum is. So there'll be a productive cough. The child will have fever that is not reduced by drugs. So yes, you will give them paracetamol, it will reduce, but then it will come back. Yeah, because you've not treated what the infection. They'll have fever. They may complain of chills at night, sweating at night. They'll have now increased breathing. So they'll be breathing very fast. And then now signs of severe pneumonia that you should, when you see these things, take the child immediately to hospital because it's a severe sign. When you see your baby turning blue, it's called cyanosis. That's a very serious sign. You should take the child to hospital. Even the fast breathing is a very serious sign. You should take the child to hospital. If you notice that they are gasping for air, that means they're having very difficulty in breathing, gasping for air. You will see them breathing like this. We call this head nodding. So they're trying to breathe in a lot of air and then exhale because they're not having a good, they're not breathing well.
Yeah.
It's called head nodding. If you see the child grunting when they're breathing, grunting is they're producing sounds when they're breathing. That's also a sign. When you check the child's chest and you will see the lower chest is going in as they're breathing in and out. It's going in. We call that chest wall indrawing. That's also a sign of severe pneumonia. And especially in children who are young, under 5, if you've noticed that they're not eating, that their eating habits have reduced, that's also a sign of severe pneumonia. You should bring that child to hospital. I hope I'm not bombarding you so much information, but these are the signs that we see. Yeah.
And I think it's important to give us all the information so that mothers do not really, or maybe even our caregivers don't miss out on any pointer. So walk us through the management. How do you really manage these kids who present with pneumonia? Even how do you really get to the diagnosis that this is pneumonia? Okay.
For diagnosis, when you bring your child to hospital, we'll first of all listen to you, take a good history, you tell us exactly what you have been seeing in your child. We write it down, and then now we can send you for tests. So the tests that we do are normally the blood tests, where we take a blood sample, we take it to the lab, and then we check if your white blood cells are increased. That would be an indication of an infection. And also anemia check, rule out anemia and rule out things that, you will check also the platelet levels to see if the clotting is okay.
Yeah.
But the white blood cells are the most important things. Chest x-ray, we'll send you for a chest x-ray. A chest x-ray is very telling, because in the chest x-ray we'll be able to see pneumonia. We can be able to diagnose pneumonia in a chest x-ray. Chest x-ray. Also, if the child has been having recurrent infections, we may choose to do a blood culture, where we take a blood sample and then we grow the bacteria in the blood sample to identify what bacteria it is that has been affecting the child. Yes, either a blood culture or even a sputum culture. We grow the bacteria, we're able to identify the bacteria, the specific bacteria, and also the antibiotics that work for that bacteria. So yeah, that's normally the gold standard for the pneumonia. Yeah, that's how we diagnose pneumonia.
And okay, and I like it when you talk about the very meticulous steps that you really take, and I see that you guys are really, prepared for this. But we see recurrences. Even after treating these children. Do you usually get these recurrences?
Yes, we do.
And why do they happen in children?
So recurrences are normally seen in children who first they have, let's say, abnormalities in their lungs or in their respiratory tract. So abnormalities, those ones are very hard words. I don't know if I should expound on them. But
something out of normal, maybe.
Yeah, something out of normal.
Yeah.
So those ones predispose their child to recurrent pneumonias.
Yeah.
2, most times the children who are malnourished, just as you said, they tend to get a lot of pneumonia because their immune system is weakened. So any exposure to any infectious agent will trigger an infection. Okay, so that's why they're normally predisposed to recurrent infections. The children who have been exposed to HIV or are living with HIV also do get recurrent pneumonias, because again their defensive mechanisms are also lessened. They are unable to fight infections. That's why they also get recurrent infections.
Yeah. And but you're able to manage them?
Yes, we are. Yes.
Oh, okay.
Yeah.
Wow, that's good to know. For those of you who are just joining us, we are having Dr. Joy from JCK Hospital breaking us down pneumonia in children, how it comes about, and also enlightening us about the predisposing factors, why it is so serious in this season when it's cold season. She's also telling us that when your immune system is low, you're affected differently, and also if there are abnormalities in your children, that is something that also will make it not easy for you to go to be treated fully. So there is so much that is going on in your body that it is imperative that you consider engaging the doctors, because they know better. And of course, the fact that we know that pneumonia is killing so many children below 5, you really don't want to take chances in regards to health of your baby. Now, in case you have any question concerning this discussion, make sure that you send it right away. And remember, the earlier you do, the better. We have an expert, the doctors, that are helping us deal with pneumonia. So send in your question right now, right here. Daktari, I'm enjoying the conversation, and I hear so many people say that vaccines are no longer helping, because we see so many people having these pneumonias and the recurrence rates are high, yet they were vaccinated. What is your take on vaccination? Do we really need to take our children for vaccination?
That's a very good question. Thank you. Vaccination is very, very important for children because it will help that child to be able to fight the infections that will be in the outside world. You know, when they're in the tummy, in the uterus, they're okay. Like minimal infections are present. But now when they come out into the world, there are so many infections around them. And by giving vaccines, you're able to protect that child. You're able to equip them even for the outside world. So it's very important to vaccinate that child. Pneumonias, we have seen a tremendous decrease in pneumonia in children who have been vaccinated, and even so many other diseases. So vaccines are very, very important, and it's a vital, and I will repeat, a vital thing to do for your child.
Okay.
Yeah.
But now we see, is it okay to someone to take a chance? Because if you are vaccinated and you still get the pneumonia and you are also not vaccinated, what would you advise? Because people feel like, it is not so effective. Why should we go for it?
It is very effective. It is very effective. I would not recommend you not getting your vaccines because yes, you may have not gotten the pneumonia, right? But you don't know the other infections that you may get because you did not get the vaccination. And just because the person who was vaccinated has gotten pneumonia, that doesn't mean that I don't know. That it doesn't mean that they are bad off, that it's the vaccine, it didn't work.
Yeah.
No, it doesn't mean that. There are so many other factors that have led to that person getting the pneumonia. But just because you don't have it because you didn't get vaccinated doesn't mean that you're protected from it. You need to get your vaccines.
Wow.
Yeah.
And that's good to know. When doctor says that it's important to get the vaccine, it helps give an added protection on your child's health. I remember one of the doctors we hosted here said you would rather be safe than sorry. And I think for our viewers, we now get it again from Dr. Joy that the vaccine is important, more so for our children because they're exposed. Another doctor here said that we are the first doctors. Parents are the first doctors, right, for their children. So it is important that you do what is good for your children because this is protection that they need and very, very key. Tell us about the state of pneumonia in Kenya. What is it like out there?
The state of pneumonia in Kenya is, we are seeing a lot of cases in pneumonia in children, especially the ones who are under 5. A lot of them. And I think the most contributing factor is our sedentary lifestyle. So the fact that children are eating a lot of junk food, they're not exercising. These things have really been contributing to children and a lot of children getting pneumonia.
Yeah.
Even that the smoking of our parents also has really been increasing, and we have also seen a lot of increase in cases of pneumonia.
All that smoking, that is it passive or active smoking when a baby smokes?
It's passive.
So babies smoke.
Oh, when the babies know.
So they do passive smoking.
Yes, they do passive smoking.
Okay,
yes,
carry on.
Yeah, smoking, yes. And also we are seeing a lot of urbanization. So there's a lot of congestion, especially in our cities, in our towns. That has also been a contributing factor to the increasing rates in pneumonia. The fact that also many children are not getting vaccinated, as you just said, is increasing the rate. Also, when mothers do not exclusively breastfeed their babies for the first 6 months, that also does predispose the child to pneumonia, because the maternal milk has a lot of antibodies, which are the natural fighter soldiers in our bodies. So when we don't exclusively breastfeed the child in the first 6 months, that is also a predisposing factor to pneumonia. And all these things have really been contributing to the increasing rate in pneumonia in our hospitals. Yeah, that's what I have to say.
Well, thank you for that State of the Nation address. And how is it like in JCK Hospital? I mean, are you getting any of these cases, and how are you managing?
Oh yes, we are. We have been getting a lot of these cases in our hospital, JCK. But because our nurses and our doctors are well equipped, we haven't been having any issues in managing them. They have been managed, and all of them have gone home having been okay. So yeah, our team is very good in what it does, and we are well equipped also in medication, in the facility, every facility that is needed. We are capable. Yes,
I love the confidence you give, and also to help us understand, because sometimes some patients come, they bring their kids, and you are not able to help them. What are some of the challenges you people go through as doctors when you are attending to these cases of pneumonia? Are there any challenges you people go through? I mean, sometimes we see that kids don't really, they come and then they're not helped so well. What happens really? Are there any challenges?
Yes, there are many challenges that we as doctors face when treating these children. The main one I would say is when a baby has contracted a very resistant bug infection, even when you're treating it, it doesn't go away. So now trying to find the exact organism that has been causing this infection is normally a bit difficult, because you will see in most cases there are steps in medications that we use. So there's step 1, if that fails, step 2, if that fails, step 3. So sometimes it becomes very difficult for us to know, okay, so what is this that has been affecting our child, this child. So that's why we do a blood culture, where I said you grow the organism and then you identify this particular antibiotic that will work. That's the only way we can be able to find out the specific organism. But yeah, it's normally a very trying time for us as doctors. But I know in JCK we have been able to overcome all those things, because we have a good lab that is able to identify the organism for us, and also the medications are readily available. So we have not been having that much problem with that.
Okay. And that's good to know, because when you talk about bugs, it's just like we see viruses, you see in computers and things like that. So we understand, of course, also, there are these patients who try out very many things. We've had a discussion about mothers trying out very many things. So when they failed, now they want to consider to come to the doctors. And then by the time the doctors try to really revive, it's a bit late, even much as you guys have the necessary equipment, the lab tests, you are sure this is what you do. But because someone has showed up very late, I think you can't really do so much. So, I mean, this is very timely conversation, more so for our parents, guardians, in case you see any of the signs that doctors talked about. This is a time whereby you need to engage the doctors, because the earlier you do, the better for you. And I know that we have so many questions concerning pneumonia in children. We are going to be answering them in the second part of our discussion. We're going to be taking a short break. And of course, do not change the dial. If this is making sense, again, share with a friend. If you have any question, send it right now. Don't change the dial. We're coming back.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
Faith Today TV is here to make your brand outstanding. Worry not on where to advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Hello there, welcome back once again to our second part of our discussion. We are breaking down pneumonia in children. It's been a wave, and as we've had in our first discussion, Kenya is really struggling with this. JCK Hospital is getting a number of cases concerning pneumonia in children. The doctors have a plan, but now this second part we want to understand how do we prevent this illness and also answer all your questions. I've seen questions coming in. That's good. We are going to be handling them. But before we took a break, Dr. Ali was talking about in scenarios when, patients come in late, when they're not able to do so much. I mean, what is the plan? Dr. Joy, help us understand. Yeah.
Thank you. Okay. So for patients who are not brought to hospital in time, just as you were saying, many parents like to try other things first before coming to hospital. So they will go for over-the-counter drugs. They will go for even this herbal medicine. I've seen so many herbal medicines being given to children, and that is not. I would not advise that, because when you bring that child to hospital late, they will come, first of all, they might come with severe pneumonia, and that will warrant admission to the hospital. And it was something that if they would have come earlier, they wouldn't have had to be admitted to hospital. You see, that's one. Two, they may also have gotten resistant pneumonia, so they will have gotten worse to the point that management of that patient becomes very difficult. So I would just advise you patients, parents, just when you see these signs, as we discussed them earlier, when you see them, just bring that child to hospital, because when you bring them early, it will help us in diagnosing that pneumonia early and even treating the pneumonia early, so that you don't have to be admitted to hospital and you don't even have to go under so many medications of that patient. Yeah.
Wow. I'm confident now. I'm really confident, and I'm sure that our viewers really get the drill. It's important. As soon as you see those signs she has talked about in the first part, that is when you need to take these children to the hospital, because you are the first doctor to your children. So let us be answering all your questions. I've seen Esther. This is Esther. Remember, for our viewers, once again, when you do send in your question, make sure that you let us know where you are watching from, so we can help you even better. Daktari, we have Esther she says, hi, are over-the-counter cough syrups safe for children who have symptoms that might lead to pneumonia?
Personally, I would not recommend over-the-counter medications, okay? Because most times you will be given drugs that will help with the symptoms, but they haven't catered for the infection, okay? So yes, you will give the cough syrup, but you have not tackled the root cause of that cough, which is the infection. So the cough might help for a while, but definitely it will come back, or even it might not help at all. So I would really implore you to just bring the child to hospital, where we'll be able to do our lab test and our chest x-ray and any other test that the doctor will recommend, so that we're able to identify the cause, treat the infection, and we can give you now the cough syrup if the cough is very irritating. So yes, no, I would not recommend over-the-counter medication.
And I like the way you put it clearly, that there's a point where you do a cough syrup when it becomes irritating. It's not the first thing you do, because most of these people who take the over-the-counter drugs, they are really suppressing the cough without addressing the cause. So Esther, you get a very great answer from Dr. Joy. They are so helpful, so very helpful. Thank you so much. Anne says, I am here. Wow, we are also here. Could you discuss how parents can strengthen a child's immunity during the cold, rainy season?
Okay, that's a very good question. I would suggest the normal things that we do. Regular washing of hands is very important in children. Also, a balanced diet. Giving a child a balanced diet. You know, we take these things for granted sometimes, but balanced diet is very important. So your fruits, your vegetables, those ones, the ones that have vitamin C, they're very good for improving and increasing your child's health. Your vitamins, your proteins, your starch, all those things, make sure you're just giving the child a balanced diet, and increase also your fruit intake. I've seen parents... Fruits.
Okay.
Yes, fruits. I've seen also parents go for supplements. Well, there's no harm. I wouldn't say, oh, it's a must to take supplements. But if you can, you can. If you also don't want fruits, they offer enough vitamins for your child. You don't have to run for supplements. As long as you're giving adequate fruits and vegetables, it's okay. But even if you choose to give supplementation of the vitamin C's, it's okay as well. It's no harm. Also make sure your child is taking good water, boiled water, to even keep them from infections. As we said, infections anywhere in your body can go to your lungs and cause pneumonia. So even when they get infections in their abdomen, in their stomach, it may still go to your lungs. So every form of hygiene is very important. Drinking good water,
And I think you're just really affirming and setting an emphasis on what we've been discussing here over time. Daktari, we've had the nutritionist who has always emphasized, and I think she's at Jessica Hospital, fruits and vegetables are very key. Vitamins are vital for our health. And supplements, of course, as long as the doctor has prescribed them for you, it's important that you are in touch with them, because I don't believe not every supplement like it means good for your child. It's important that, like doctor said, you make sure that you engage them and be helped well. So immunity is very key, and it's a check whenever a child gets an infection. So, and thank you for that question. We have another one, says, "Hi, I'm loving the insights. Awesome. And thank you for following. Does breastfeeding offer any protection against pneumonia during weather changes?"
Yes, it does. As I had said earlier, breastfeeding, exclusive breastfeeding of your baby is very, very important. Because the antibodies, which we call the natural soldiers of your body, the maternal antibodies can be transmitted to the baby through breast milk. And this will help that baby fight infections that they collect in the outside world. So exclusive breastfeeding, we keep emphasizing on it. It's very, very key. Even you're able to get the vital vitamins from breast milk that the baby needs to be able to fight infections. Breast milk has everything, and it's very important to breastfeed that child.
I think God is so smart.
Yeah, he is.
God is so smart. I think we need to just appreciate nature and also follow what the doctors are telling us. Exclusive means just breast milk. Don't add on any other thing. Very important for 6 months.
6 months.
All right. We have another question from, I don't know why this viewer didn't put the name, but please do as you send in your questions so we can help you better. I know the questions are even flowing on the screen, as you can see there. So we have, good morning. Can pneumonia in children develop without any cough or fever?
I think in very, very, very rare cases, yes, it can develop without cough or fever. Very, very rare cases. But most, especially in viral pneumonia, viral pneumonia, where it's caused by viruses, they are normally the symptoms are not that pronounced. Yes. So viral pneumonia can inapenda kucheza chini. The symptoms are not very pronounced. So, but in very, very rare cases, most times when you have an infection, it will show you by a fever and cough.
All right, and I believe this viewer here wants to just get the latest or the specifics from the doctors. If you are not sure, this is the best time for you to engage the doctors, because I mean, do you have a place of even examination, doing the extra mile, doing the tests just to rule out any, probable cause? So for our viewer, it's important that when you are not sure, doctors say it's better you are safe than being sorry. All right, I have my baby Stella. This is Stella from Homeland. Wow, just near here. My baby has been sneezing and has a mild fever. Could this be an early sign of pneumonia?
I don't want to say yes to scare you, but I would advise you to go and to come to our hospital. You're very much welcome to Jessica Hospital. We have tests for you to be able to help you know if it is pneumonia. But based on the sneezing and the mild fever, it may not be pneumonia. It may not. But you can't just know this by the symptoms you give. We need to do tests to be able to confirm that it's not.
Wow, that's good. Stella, just in Homeland, thank you so much for following this discussion. I hope that you have subscribed also. We have so many questions today, and I'm happy that you're doing justice to them. For our viewer, I hope that we do
answer yours as well. Hello, loving the show. I hope you've captured that. This one is loving the show. Are indoor humidifiers helpful or harmful in preventing pneumonia during rainy seasons?
Thank you for the question. I don't think they're helpful, neither do I think they're harmful. Yeah, I don't think they add any value to you. Just humidifiers are used to create warmth in the room. Okay, it may help, but no, it's neither here nor there.
Yeah.
That's what I think.
Yeah. So the idea is make sure that you are warm.
Just make sure the baby is warm. They're wearing sweaters. They're well covered up.
Yeah.
Yeah, and they're taking hot fluids, not cold things.
Okay.
Yeah, and avoid sugar as well.
Yeah.
Sugary things.
I mean, like you have said, humidifiers, it's not a gold standard.
No.
Like everyone should have them. Those who can afford
It's okay.
can, but those who can't afford, like you said, hot water. What else?
Warm. You wear warmly.
Yeah.
Yeah.
Those warm clothings. I mean, very, very important. So, that is it for you. I didn't get her name, but I'm sure that she gets the answer. We have Mackenzie. Good morning, doctors. Is it true that quick temperature changes, like moving from cold to warm environments, can cause pneumonia? Quick temperature changes.
Okay. No, I don't think so. It's yes, we've said the cold does stimulate. Okay, it does predispose you to pneumonia. Yes, but it's not that it's the cause of the pneumonia. You get what I'm saying?
Yeah.
The infection is the cause of the pneumonia.
Yeah.
So yes, it does predispose you to getting pneumonia, but it doesn't cause. So that change in temperature is not the cause of the pneumonia.
Yeah.
You are just highly predisposed to it.
Yeah.
So if you do get it, we call it an infection. It's not because you changed your temperature.
Yeah.
Yeah, I don't know if that's understandable.
Clear, very understandable, because when you talk about that, also not for people to feel like, when there is a shift in environments, that is going to predispose them to bacteria. The infection could be there already, and now maybe this is when it shows up.
Yeah.
Yeah, but again, like we've always had, it's important that you do the tests to rule out any doubt. Mackenzie, thank you so much, Mackenzie. Questions are in today, so many. I've noticed my child coughs more during the rainy season. Should I be worried about pneumonia?
Oh, that's a good question. Yeah, we see a lot of children coughing a lot during the cold and rainy season. Most times it's a common cold, and we have seen that via the tests we have done. So yes, I would recommend you to just come to the hospital to get your tests done. But coughing during the rainy season is a very common thing, and it's mostly due to common cold. So when you come to our hospital, we can be able to differentiate between the cold and pneumonia. I cannot tell you that, that patient has pneumonia just because that they cough a lot.
Yeah.
There have to be tests done to rule out pneumonia and say that this is just a common cold. Yeah.
Wow. Awesome. And I think, Daktari, when you speak of that, I know our viewers, if you don't answer this question, they may be mad at us. Children are now back to school.
Yes.
And we see them going very early. What would you advise parents to do to prevent any kind of, infection right now? I mean, for the parents and caregivers, maybe this is a point where you, address that.
Okay. That's a good question as well. So yes, when children go back to school, they tend to give each other so many infections.
Yeah.
And we have seen that. So how to prevent is, we talked about it.
Yeah.
Give them a lot of fruits and vegetables. This will help strengthen the immune system, such that even if there are a lot of infections in their class or in their school, they don't get them very easily because their immune system is able to fight. Okay. 2, make sure, okay, you can give supplements. Give supplements to that child.
Yeah.
Make sure that they're taking good care of themselves, hand washing, they're taking clean water. Do not limit their interaction with children.
Yeah.
I do not advise that because they are social beings. They need to know how to socialize with their classmates.
Yeah.
So that limitation of, you do not work with this one because they have a cold, I wouldn't recommend it. So just to keep them warm as they're going to school. Make sure that the teachers also are aware about hand washing, about how to take care of the children when they're sick, how to report to even the parents of the children. When they see a sick child, they report them so that they're able to be given drugs early to prevent also transmission of the conditions to the other children. Even if it's your child as well. If you see that they have maybe a cough or a cold, you can take them to hospital. They're given the right medication so that they're not able to even transmit it to other children early enough. Those are some of the things. Just make sure, especially I'll just emphasize on the diet. The diet can do wonders. It's very, very, very important.
Wow. Thank you so much. For our viewers, you can tell we are getting really valuable information from Dr. Joy here. Again, she says it's important. You don't need to isolate your kid from all the rest because, it's a cold season and things like that. It's important that you do your best to address the nutritional gaps, make sure they have the right fruits, vegetables on a daily, make sure they are warm, like she has said, hot things. It's very important. Then she has also talked about supplements. I think this is where when the doctors recommend supplements, when they have prescribed them, you take them because they have done the prescription. So it's important to note that you may be required to have an extra reinforcement in this season. Dr. Alice, questions are coming in today. We have one from Hannah. Hannah, I hope it has been displayed on the screen. Hannah says, is there a way to tell if a child has pneumonia or just a bad cold when the weather changes? Some people want to be doctors.
Oh, I've seen. I think we've tackled this question again. So how to know that this child has a common cold instead of pneumonia? I think the safest way to know is just to bring that child to hospital. That way the doctor can tell you. And I don't recommend going to, as we said, over-the-counter medications. Just take them to hospital, and that way the doctors will be able to examine them. So how we know as doctors that this child may have pneumonia and not common cold is we tend to listen to the lungs using the stethoscope. I know many of you who've taken your child to hospital, you've seen us using the stethoscope. There's a sound that we hear when we listen to the lungs. And if we hear that there's an abnormality in that sound that we hear, that's how we are able to distinguish common cold from pneumonia. That's how we are able to distinguish. But the symptoms are normally the same. The fever, the cough, the chill sometimes, the sweating at night, those things are normally a bit similar. But I think the best and the safest way to know and to differentiate the two is you bring that child to hospital where we are able to rule out pneumonia for you because it's very hard for you to rule it out by yourself. Not, you can't be able to. Even me, if I don't take my stethoscope and listen, I wouldn't be immediately. You
can't tell. I think that's why you guys do the training, the 7 years. It's a long time to really help people, isolate these illnesses and help them better. This has been very helpful. I know we are going to be concluding right now, but for those of you who are joining us, again, remember this program is only possible because of JCK Hospital. You can find them in Roysambu along Lumumba Drive, just opposite Park University. And that number on your screen is what you can use always to get any help. In case of any emergency, extensive consultation, you have your answers right there. Daktari, I know we are going to be concluding this. I know you're a faith-based person, you are a believer, and on this program we have so many people who follow us, not just, on social media. Some are at home, some are in hospitals, so they receive this treatment. So I want you to look at the camera and give a word of encouragement and also hope to those people who could be receiving any form of treatment right now.
So, okay, yes, I feel for you, for those who are being treated for any disease, but I want you to know that God has seen. Our God is El Roy. We call him El Roy because he's a God who sees that pain that you're going through, all those struggles that you're going through, financial strains that you're going through. And our God is more than able to heal. It's not because you have done anything wrong, especially for the mothers who have children with pneumonia. There's nothing wrong you have done for your baby to get pneumonia. I want to assure you that. But our God is our God who heals, and he heals. When he heals completely. So just keep on trusting him. He never fails, and he is faithful to the very end. As long as you pray and you have your faith on him, he will heal and he will rescue.
Wow, a moment of silence for that. That is deep. Thank you so much, Dr. Joy, and I'm sure that our followers have gotten encouraged. Their faith has been built, and of course, if you're getting it from a doctor, what else do you need? For sure. These are people who are integrating faith in health, and that's, I believe, why they're having results. Once again, thank you so much for tuning into the Healthy You program. For all of you who are following us, again, we always remind you it's important to be proactive rather than reactive. She has talked about hand washing, very important. We've had doctors on this set talking about that, demonstrating the technique. And so it's a cold season. And this is a time where you want to utilize all the skills you've learned. She has talked about hot drinks. Make sure you are taking hot things more than the cold things. She has talked about making sure that you do diet, get the fruits and vegetables, what the doctors are saying. In case you're not sure about what to eat, we have a nutritionist who can help you again with that. And of course, don't take chances when it comes to matters health of your children. Doctors are trained 7 years, just to help you deal with this illness, because prevention is better and always cheaper than cure. So for those of you who always enjoy these discussions, again, I want to remind you this program has been brought to you by JCK Hospital. They recently launched the College of Health Sciences that is now shaping careers. They're running their second intake, so I will encourage you to reach them using that number on your screen. Get listed, get these skills, and then get attached to JCK Hospital so you can get these you can get skilled, you get the experience, so you're competent even when you go out there. Those of you who follow us and you are under any form of treatment, the doctor has made it clear today, God heals. Doctors are only an extension of God's healing hand, and we pray that may your healing come forth speedily. Right now, if you believe, you can say amen. My name is Enock Kitondekijja, and this has been the Healthy You program. Until we meet next Tuesday, same time, stay proactive, stay informed, stay warm. God bless you.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.